I'm Dr. Stephen Bogosian, Syracuse orthopedic specialist, and I specialize in adult reconstruction, which are hip and knee procedures. I grew up in Messina, New York, in the North Country. Went to high school actually in Messina, and then I went to the United States Military Academy at West Point. Following that, actually, I was commissioned as an infantry officer in the Army for 4.5 years. And after that, I went to the Upstate Medical Center for medical school. I did my internship in general surgery in Santa Barbara, California. Came back to Syracuse, finished my residency program in orthopedics. And then I did an adult reconstructive fellowship at New England Baptist Hospital in Boston, which is an auto-offering fellowship in adult reconstruction of hip and knees. I was a student athlete. There's no advantages actually to being a student athlete at West Point. It's actually just more work. It was one of the best things I've ever done in my life. I was elected as the football captain. When I was there, I was also an All-American there for 2 years. It was a experience at West Point that, not just for football, but the whole process is what shaped me for the rest of my life, actually. There's a fellow named John Fagan, who's the orthopedic surgeon, actually the team physician at West Point, who's still a very close friend of mine, who actually guided me through the process. I thought about it when I was there. I was in the Army for 4.5 years. I had a knee injury, which changed my military career, so I had to look for another profession. I'd met a number of different physicians, actually, that were West Point grads. When I was at that time, I was at Fort Carson, Colorado. Became very friendly, and actually I decided that it was something that I wanted to do. So I went back to night school, actually, at University of Colorado, because at West Point we're engineers, and you have to go back and do sciences. So I went back, got my biology and organic chemistry and a bunch of other sort of things I needed to do, and I took my MCATs, did well, and I was lucky enough to get into a medical school, and it was here at Upstate. Most of us strive to care for our patients in a way that I think that we would want to be treated if we were sitting in that same seat, and that's what I try to do. I do think it's important to try to get a history from the patient of what their problems are, do a physical exam, do any studies that need to be done, and try to give a diagnosis which is in line with that. The plan portion of that is something that we discussed a lot actually with our patients in reference to their part of the plan, in reference to how to treat certain disease processes, especially with hip and knee problems. It's important actually to have them be a participant with that because the results will be better. And there's a number of different modalities that we use from diagnostic standpoint as well as treatment. And initially we always try non-operative treatments. Eventually sometimes operative treatments are always an option, but usually that's later in the process. But initially non-operative care is what we initially try for most things. Joint replacements have changed over the years. Initially when we started doing joint replacements, actually a patient would be in the hospital for 2 to 3 weeks. And then that's slowly been narrowed down now where in my own practice, about 20%, 30% of my patients leave the following day. And I do think, and across the country now, there are a lot of centers that are doing joint replacements as outpatients. And we'll probably end up doing a significant number, maybe 15 or 20% of our patients that we're joints on, as outpatients because they're healthy, they're active. It's less risky for them, believe it or not. There's less chance of actually getting infections, blood clots, because they're more mobile. So it's actually safe for them to be away from the hospital and be home rather than in a hospital setting unless it's absolutely needed. Memorable moments for me actually happen all the time. I think the most memorable moments, I think we go on, some of us go on a program which is called Operation Walk, where we take essentially an operating room, nurses, technicians, physical therapists, other physicians who are not orthopedists that are internists, as well as that are cardiologists, and we essentially bring a hospital with us and we do total joint replacements. And we've gone to Nepal, we've been to Panama, Guatemala, and most recently we've gone to Ghana twice, and we're going to go back again. Those patients never see any physicians. They have no care available. Their lives are completely changed with what we do, and it's probably one of the best times of the year for me. My free time, actually, I'm a cyclist. I like to ride a lot. I play a little golf. I'm not very good at it anymore, but I still do it more from a social standpoint. And the other, actually, one of my kids got me started. I'm a beekeeper. Actually, I have hives in my backyard. I've got 4 hives in my backyard, and I care for them. And that's actually the bees have been around actually since the dinosaurs, and we're killing them, and we're affecting our own produce because 70 to 80% of what we eat actually come from bees with pollination. So it's actually kind of enjoyable. Well, I think yes, Syracuse orthopedic specialists actually came together. And I was one of the original surgeons who helped put it together. But essentially our vision was, and exactly is what's happening now, is each one of us have always, when we first went into practice a long time ago, would do a lot of different subspecialists in orthopedics, but a lot of us had actually a concentration. My concentration always been with hip and knee problems and with reconstruction, with joint replacements. There's others that are hand specialists. There's others that are shoulder specialists. There's other individuals that are spine specialists. There's sports medicine. Everybody has a special interest. And one of the things that we've tried to do here is actually allow each one of us with a special interest to work in that interest. And if somebody wants to be a general orthopedist, they still can. But with the special interest, it allows you to care for certain patients that have a specific problem that you see all the time. It's safer for the patient. You're seeing somebody that actually sees them all the time and deals with them all the time. So actually, usually most of us will be up to date with how we care for them, how we make a diagnosis. And that actually, I think, is special for us because we've allowed each one of us to grow in our own field, and it's good for our patients and it's great for the physician.